I am the Tofu Golem. Please enjoy the video.
You begin by confirming the medication, dose, and vial integrity. This reduces errors. Put on gloves and open your sterile syringe without touching the hub. Pull back air into the syringe equal to the intended dose so you can inject air into the vial. This prevents vacuum. Clean the rubber stopper with an alcohol swab for 2 to 3 seconds and let it dry. Once dry, insert the needle through the center of the stopper at a slight angle to maintain sterility and stability. You inject the pre-drawn air into the vial and then invert the vial so the fluid covers the needle tip. This balances pressure and eases aspiration. Slowly withdraw slightly more than the ordered dose. Slow movement minimizes bubbles. Once drawn, tap the syringe to move bubbles upward and gently push plunger to expel them until the exact dose remains. Make sure to replace the drawing needle with a fresh administration needle if required. This prevents coring and reduces patient discomfort. You confirm the syringe shows the exact dose and then secure a cap using a one-hand scoop or place a sterile cap. Label the syringe with medication, concentration, and time to avoid confusion. Dispose of the used vial and drawing needle in a sharps container immediately to maintain safety. If you see visible particulate or persistent bubbles that won't clear, do not administer. Discard the vial and syringe and redraw from a new vial using aseptic technique. This prevents contamination and dosing errors.
Thanks for watching. Consider subscribing if we helped you today.